Okay, we're looking at the dog heart here. Let's look at the back. We have the cranial and the caudal vena cava, which are feeding into the right atrium. This right atrium, we're going to flow through the tricuspid valve into the right ventricle. Our right ventricle is going to then pump up through here through this valve, which is going to be called the pulmonary semilunar valve, through the pulmonary trunk. We have the left and the right pulmonary arteries leaving the heart. They're going to come back as the pulmonary veins feeding into the left atrium. The left atrium, we're going to look at this side here. We can look at these different types of muscle here. This type of muscle is important to know, called the musculi pectinati. Okay, we're going to be flowing through again this mitral valve. Again, we can see this chordae tendineae. If you look, you can see these little tiny papillary muscles. These papillary muscles are what's going to be pulling down on that valve to close it. Finally, we're going to have be in this left ventricle, pumping out through here. We're going to get to oxygenate the rest of the body through the and then passing through this intraventricular groove and septum here. This is the aorta, or the aortic arch, sometimes called too, in order to get there through the semilunar valve. Forgot to mention. Okay, then we're going to have the right brachiocephalic artery here, the left carotid artery here. Finally, the last of the coronary veins. This is how the heart gets its own blood supply. The blue 17 here is going to be the coronary vein. The red is going to be the coronary artery, or 13, and finally the apex again at the bottom.